Hi everybody, this is Fibromyalgia Awareness Week from the 2nd of September, and I wanted to share with you some of the top tips that I have for dealing with the pain that you get from fibromyalgia. I know that there are so many alternative ways of dealing with pain, and some of them I've already touched them on videos, using heat and using cold. But I think it's really important to understand the role of medication in pain control. Obviously, when you're talking the first level of pain control, it's understanding the ways that paracetamol and ibuprofen can work. Ibuprofen being better at dealing with inflammation, but unfortunately not useful for everybody, as the side effects can be too much for them. If it's affecting your tummy too much, then that's the time to go back to your GP and ask if you can have a trial of naproxen. Most people find that kind of level of medication is nowhere near enough to help with the level of pain you get with fibromyalgia. So the next level of medication that would potentially be offered is actually an antidepressant, quite often starting with amitriptyline. Although it's useful as an antidepressant, the using of antidepressants is more to help with calming down the pain, and I've seen it being offered to people in short-term and long-term usage. So please don't be put off. Please don't think your doctor is trying to palm you off and just kind of mollify you with a drug that makes no sense. An antidepressant is genuinely a good way to try and work on pain management. Personally, I found an antidepressant really useful at a low dosage, but I had to experiment with several brands to get something that fits me and all of the conditions I have. At the next level up from that would usually be, there's two anti-epileptic drugs, not used as much for epilepsy as for pain control. And quite often a doctor will use gabapentin and trial you on that. And if that's not working, move to pregabalin. Both of these medications I've tried. I was great on the gabapentin for about 2 years and then found it wasn't as effective as I needed it to be, and I've moved to pregabalin. The kind of potential next level up is your opiate level drugs, like your codeines, moving up from codeine up to morphine. And most of you will know this in the form of cocodamol. Just depends on your GP as to what they will offer first. So it's useful, do your own research so you kind of know what you want to try next. And always bear in mind that it is possible to be referred to a pain clinic if you are really struggling to get your pain under control. I have heard really mixed reports on how effective going to pain clinic is. But if you're looking for information that's further than taking just your basic cocodamol and trialing anything like the pain patches that people use, my understanding is that would be potentially through a pain clinic. I know that cocodamol is not the best painkiller for fibromyalgia, and I would say that the other routes are really useful to know so that you are not relying on a really high dosage of opiate when you could have other painkillers coming in, and use like a really multifactorial approach. So for example, I use cocodamol plus pregabalin and also the antidepressant, as I mentioned. Cocodamol comes in different strengths. I have your normal strength, which is your 8-500. That's kind of you can get over the counter, and I also have some 3500s that I use for bigger pain days. I want to make this video brief, so just to finish by saying that if this is something that's new to you, then please look into it further, because finding out what medications work for me has helped me. It's definitely not made enough difference to say that my pain levels are totally under control. I would love to say that. But without understanding the different ones that you can try, sometimes you can end up on a pain control medication system that really doesn't make the best use of avoiding side effects, whilst also being effective enough. So if you have any questions, please drop them in the comments below, and I hope to make much more detailed video on this. But as it's a Fibromyalgia Awareness Week, this would be a great time to share with your friends, share with anybody you know, just to say to them, look, do you understand just the basics of medications, and are you using them? And I wish you all the best. I hope for everybody they can find the combination that gets the best out of pain control for them. So wishing you just so many hugs this week. I know so many of you would love for Fibromyalgia Awareness Week to make a big difference. So let's hope in this year that more and more people learn about the condition and learn about how to deal with it. So thank you so much for listening, and I'll speak to you soon. Bye.